Hello, and welcome to the Workforce Wisdom Podcast. I'm your host, Christy Bray, Chief Strategy Officer at PracticeLink. In this podcast, we will focus on the latest trends in healthcare recruitment while showcasing innovative strategies, success stories, and fresh perspectives affecting the healthcare workforce. These episodes lead to in-depth and thoughtful discussions with recognized industry-leading healthcare professionals exploring the challenges of healthcare recruitment and beyond. Whether you are an experienced recruitment professional or just starting, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's guest on Industry Insights, Recruitment Excellence in Healthcare is Jennifer Lynch. Jen graduated from the University of Missouri with a degree in journalism and worked as an advertising copywriter for a number of years. She transitioned into healthcare in 2000, taking a position in a community hospital where she did a little of everything: recruited providers, served as a physician and community relations liaison, led the customer service initiatives, and assisted with strategic planning. By 2016, she was recruiting for 9 LifePoint facilities in the Midwest and South. In late 2021, she was tapped to lead the recruitment efforts for a new company called ScionHealth, which has 75 specialty hospitals and 15 community hospitals across the country. She oversees a team of 3 who recruit the physicians and APPs needed to make the hospitals and clinics run. Welcome, Jennifer. Thank you for joining me today.
Thanks for having me, Christy.
You've had a long journey in healthcare. Tell us a little bit about becoming a leader, specifically in the physician recruitment space, and some of the challenges you faced along the way.
Well, sure. I would say it was very organic. Beginning in college, I tended to find myself naturally gravitating towards leadership roles, whether it be a group project or in my sorority, for example. And that has continued throughout my career. Starting in that hospital setting, I was part of the administration team, but I had no direct reports at that time. My first direct reports in that setting came from my penchant for embracing customer service and how we can translate that into a better example and experience for our patients in registration, in dietary, and housekeeping. So suddenly I had those 3 departments reporting to me, and I did pretty well with those. And as it happens, when one does well, I had additional responsibilities put upon me. And one of those was recruitment. My CEO at the time recognized my passion for ensuring a positive patient experience would also mean that I would only want the best physicians and APPs to come to our community to take care of those patients. At the corporate level, there had been some changes to the recruitment structure, and the result was that I would be recruiting for 3 regional hospitals in my state. The biggest challenge that I faced at that time was really wearing a number of hats and finding the time to do those things. I was still doing community relations, I was doing marketing, I was doing recruitment, I was doing strategic planning, customer service, and I was a physician liaison. I used to joke that my business card was a fold out like 6 or 8 pages. Time was precious, and there were days, honestly, that I felt I wasn't giving enough to one hat or another. However, I don't know that anybody else noticed because it wasn't long, and I found myself tasked with recruiting for 9 hospitals in the region. And by this time, the structure had changed again, and I no longer had the physician liaison piece, the marketing piece, registration, housekeeping, dietary, and all of those. So I really could focus on recruitment. And then in late 2021, I began my current role, which is oversight of all the physician recruitment for a brand new company. And I have a team that reports to me.
Tell us a little bit about, because I know that you have lived in the communities that you serve, or at least primary community that you served in the beginning. That experience is a little different. A lot of our workforce has moved to be remote and typically not on site doing candidate site visits. But I'm curious maybe how your experience with community relations kind of influences some of that approach to recruiting healthcare providers in specific regions where you don't live. Obviously, you visited and you know the community, but when you're talking to folks, that can be a little bit different than the investment of where you live and potentially where your family seeks care.
Absolutely. I think that my community relations experience really provided me with empathy for the residents that our facilities serve. And it isn't to say that all of the communities are the same, because they're not. They do have some things in common, but I think that really understanding when people live in a smaller town, they always think that the hospital in the big city is the one that's bigger or better or whatnot. And I was out and about and I was hearing so often the real stories of people that had good and bad experiences in our facility as well as in, I'm going to say, competing facilities in the next big city. And it gives me a drive to want to make sure that I'm bringing the best physicians to the residents of the community, because those are people I have to face sitting across the table from them at Rotary or running into them at the bank or at the store or a ball game or something like that. It also helps me to understand what really fits in one town doesn't necessarily fit in another. And I want to fit for the long term. It's extraordinarily hard on a community, on a hospital, and on a physician when it doesn't work out after 1 or 2 or 3 years. And I guess to sum it all up, I often feel that we are matchmakers between physicians and communities.
Yeah, absolutely. That came up in another episode that I recorded. And it's always hard to explain, like, to your parents what you do for a living. And matchmaking was the easiest way to do that for me. I know some of your areas are rural and potentially underserved. Throughout your career, as you have been the recruiter for those areas, trying to bring this talent to them, what are some of the challenges? How did you overcome them? And then maybe some success stories you've had there.
Sure. First, not everyone's really suited to living in a town of 8,000 people or 20,000 people. And if a doc comes to town and they want to know where Nordstrom is, it's probably not the right fit. Walmart, we've got it. And I think probably most of our communities have a Starbucks now, but we don't have Nordstrom. Seriously, though, that fit is just so important. And someone for a passion of being in a smaller town, someone who understands that there's not reliable Uber service or a lot of cultural events like a symphony or museums, someone who can relate to ranchers and farmers, bankers who maybe have lived in town and had their job passed down for generation after generation, teachers, mechanics, someone who can relate to those, and somebody whose family is okay with that as well. We overcome those obstacles by vetting very, very well. We know our type, if you will, and we'll pay for the hunting and fishing license, for example, because those are the kinds of hobbies that the folks that like our communities probably like doing. Another thing that we offer that probably not everybody offers is student loan assistance. So that's something that helps get folks to our community, and certainly with hopes that they're going to fall in love with it and want to stay there for the long term.
Those are good points. I think, you touched on some of the unique aspects of physician recruitment. I think they spill over into APP recruitment, especially as you get into valued specialty APPs, CRNAs, and those folks that are very difficult to find too. But compared to other recruiting and potentially even your days when you needed to replace housekeepers and even volunteers, that becomes an aspect of recruitment. Give us a little bit of a comparison between those two. You provided some good ideas for how do you attract people, and those aren't too different for physicians, just they are high income earners. They went to school for a long time. But the same thing needs to be said for some other workers to keep them engaged and in the community as well.
I think that the biggest difference between recruiting what I'm going to call staff level versus physicians and APPs is really in the relationship building. Largely, the folks that you're bringing on for staff level, with a few exceptions, of course, are going to be folks who already live in the market or live around the market. You're probably not bringing them in from someplace far, far off. Whereas with physicians and APPs, it's very, very likely that they've never set foot in the town, maybe even not even been close to it, sometimes not even set foot in the state before. And so building that relationship so that they're comfortable being there and also that they want to stay there for the long haul, making sure that they're invested and they can put down roots. Whereas on the staff level, they've probably already got those things built in to what they're doing. They've been there. They know folks. It's not so much of a relationship building as it is with a physician or an APP.
Yeah, I think when you've got some competitor systems near or around, I see people in non-physician roles, non-clinical roles, they are willing to drive for that culture and that supportive environment for them to work in. We see that here locally quite a bit. So your team works all remotely and they have from the beginning of Scion in late 2021. So with that aspect, kind of tell me a little bit what strategies you found to be most effective in building that new recruitment team from the ground up. What helped you develop a culture and just stay aligned with that team as their new leader and then pushing them forward into the business that needs to be done.
I would say that having the opportunity that, in my case, I knew these folks that were tapped to come with me beforehand. So I already had a sense of who they were and what they could do, what their strengths were. But I spent some time at the beginning really kind of digging into what are their goals individually, what are their dreams, what are their obstacles, what works well for them. And as the team has grown by one, since the beginning, I really have continued to employ that, having regular one-on-ones where I'm touching base and asking, hey, what's going well? What's not going well? Are there tools that you have seen that maybe would work better for you? I'm pretty flexible with regards to, I don't say that everybody has to do everything the exact same way, with exception to you have to do this list of things to make sure that we're tracking everything properly. But how you get there is kind of personalized. It's almost like new math. How you get there is not the important part, it's the end result. So just staying in touch and staying in tune with the team. I think the big challenge of being remote is you feel like you're kind of an island and you don't have really an identity with your quote unquote corporate structure. So I do everything that I can to make sure that they still feel a part of a team and a part of a larger organization that has a mission that we can all relate to and want to do better for.
Yeah, that was going to be my next question was, really keeping them motivated and aligned when they may or may not live in the communities that they serve. And definitely with a new company, getting people's buy-in within that piece.
Sure. I think that those consistent reminders of why we're doing what we're doing and the impact that we can make on each one of our communities, reminding them of that on a regular basis is important. And fortunately, in our organization, senior leadership is very good about praising our efforts. I make sure to pass those praises on to the team. We've all been to our communities, so we can see how important it is to put quality healing hands in the communities where our residents are.
Did you know PracticeLink is not only home of the most widely used online physician job board, but we also have our own magazine? PracticeLink magazine has not only won several awards, including 2 ASBE Awards of Excellence in 2023, but it's also completely free. Over 375,000 physicians and residents receive copies of PracticeLink magazine each year, and you can too by visiting practicelink.com/magazine. That's practicelink.com/magazine. Thank you for listening. Now we'll return to the podcast.
So earlier you mentioned some metrics and keeping track of metrics. And I know that was the one thing that I could use to my advantage to get extra FTEs or extra vendor support and going out and buying other products and sending folks to conferences, et cetera. So could you elaborate a little bit on some of the metrics that you use when you report up to your senior leaders? And then how do you approach collecting all of those through an applicant tracking system, those types of things where you're required to provide some cadence of reporting?
So some of the things that I report on, and I think that this goes hand in hand with what you mentioned about supporting, for example, getting an extra FTE. One of the things that I report on every month is obviously the number of signed physicians and APPs that we've had in the previous month, in a graph alongside the number of open positions that we have. Early on in the company, first probably, 4 or 5 months that I was reporting, I was not reporting those two things side by side. And somebody asked me, well, how do you know when you've reached 100%, or when will you reach 100%? And I was like, well, that will never happen.
Never.
And so I started putting those two side by side, and they could see you're hiring well, but your jobs, they stay fairly steady. So it's two line graphs, and they can see that even though we may hire 10 this month, but guess what? We've got another 10 positions that were opened. And so that's one thing that I think is very important to report, so that they understand what the workload is. And for us to go out and get more, we might need a bigger team. We might need to look at a different way. So those are a couple of things that I report on. I also report on the length of time, or time to fill. I mean, that's a pretty common recruitment metric that a lot of us track. And of course, we celebrate occasionally. We've got a position that's been open for 3 years or 4 years. And when we sign that person, there's a celebration. So that's another one of the metrics. Also, we track against prior year, which I'm happy to say each year we've successfully gone a little further than we did the year before. Of course, we're also tracking what I would call kind of the priority of each of our recruits, and kind of wanting to knock down the ones that we consider kind of critical, that we needed them yesterday, and see maybe that number getting smaller and the number getting larger when we're looking at the future. What are we going to need for the future? I'm happy to say that we're at a point where a number of our facilities are actually looking 3 and 4 years into the future. And we're signing some folks that are that far down the line as well. And I'm happy that we're doing that, because I feel that that means that we're really looking to address the concerns that are going to come down the road in a couple of years, not just what's in front of us today.
You mentioned looking at kind of the net number instead of the two separate numbers, but I wonder, is someone tracking, maybe it's HR or someone, are they looking at the attrition rates and maybe the reasons why? I'm curious if a lot of it is retirement, or if it's other reasons that they're going to the competitor or completely leaving the community.
Sure. And that is one of the metrics that I report on as well, is why are we recruiting? And I'd say we're a little bit heavier on recruiting for growth rather than replacement. The physician enterprise as a whole, the folks that are in charge of operations, they are tracking why somebody leaves. And of course, even I would say, as I said, we're a little bit heavier on growth than we are on replacement, but some of that replacement is not necessarily a bad thing, but we do track that as well.
And you also mentioned tracking the criticality of something. And I'm assuming, some of that can be you don't have a provider in place serving the community in that specialty, or potentially, especially if it's a surgical specialty or something, you've got a locum in place. So you have coverage, but a higher price point you want to replace. Anything else you look at, and how you might allocate or change some of your resources to source for those positions from job boards or emails or texting, anything related to that when you change that based on the critical nature of the search?
Those critical searches are really what's going to move the needle for the facility. Financially is probably the biggest piece, but you also want to make sure that the needs of the community are met, of course. So that's a big piece of how hard we go on something, on a search. That said, sometimes it's critical to add something as a defense against what's maybe being added across town or in the next town over, or whatever the case may be. But we're really working towards moving the needle and meeting the needs. Those are the things that are kind of top of mind. And the bulk of our efforts really do go into those critical, and then the ones that are nice to have in the next 12 months. I indicated we've signed some already for 26, 27, but we're not spending a ton of time looking for those yet. We're really focused on and put our money in who we can get today and who we can get in the next 9 to 12 months.
And it sounds like you're heavily involved within some of the strategic planning and those growth objectives. What advice would you give to other recruiters who may not have the same seat at the table that you do, in terms of how they might be able to help their leaders prioritize in this way and align those recruitment goals with the organizational growth?
I think number one, always ask for a seat at the table. The worst they can do is say no. And if they say, why do you want a seat at that table? It's because, number one, it's going to help you as a recruiter to understand and hear the greater discussion, of course. That's going to help just solidify the knowledge base that you have to recruit for this facility or that clinic or whatever the case may be. But the knowledge that you can bring because you're talking to umpteen people every week, and you have the benefit of hearing what they're hearing from other places that they're interviewing. So you kind of bring in a little bit of a fly on the wall, which is something that the O suite may not have access to. You've got something a little special hearing from those candidates. Well, I've interviewed here and this is what they're offering and this is what's happening. You're a fly on the wall. You're hearing that. You can bring that to your O suite.
That's great advice for folks, especially if you're just starting out and not knowing, everything is on fire and an emergency, depending who you ask, which department or which specialty line, and trying to really understand you do have limited resources, people, and tools that you use, and you want to do your best work for everyone. Can you talk about a time when maybe you had to adapt that recruitment strategy because of a really quick change, either in the industry, maybe the local market, you were heading down one pathway with maybe growing a service line, and then you had to pivot really quickly and change some of that strategy?
The first thing that comes to mind is COVID. I mean, didn't that all just change our lives in a big, big way? So, prior to that, you'd have a call with a candidate, and the next step, if it felt like a good thing, the next step would be bring them on for a site visit. And then suddenly, nobody could go anywhere by air. You couldn't enter a hospital without a decree from the CDC or whatever. Literally overnight, we couldn't do what we were doing. So, quick adaptation. It was all Teams interviews, and we were signing candidates who never ever set foot in the hospital, the clinic, the town, sometimes the state that we were bringing them to. That said, I think that our dedication to making sure that the fit was good all the way around was really more heightened then. And we became experts in knowing our communities well enough to make candidates comfortable with the fact that they're signing this ginormous deal, basically sight unseen. That was a major shift. And there are pieces of that, I think, that still linger today. Candidates are much more comfortable with a video interview, for example, than they were in the past. Although still, just about every time you get on a call, somebody's got themselves muted. And, we're 4 years into this. We should know better. But seriously, I think that there are pieces of that we've been able to take forward. We took the best of what we learned in COVID and moved it forward.
I don't think it ever was about the expense of the site visit or the time or the dinners and all the things, the planning that goes into it. I really think it was an opportunity to showcase your community and build that trust with the candidate while they were there on site. It shows that you and your team, definitely your leadership teams locally, they've been able to do that and build that trust with the candidate that this is a great match for them to consider for their future. Speaking of technology, is there anything else that you feel like has really changed kind of the approach to recruitment, healthcare recruitment specifically, and maybe where do you see it heading?
From the very beginning of my recruitment experience, back then it was a lot of cold calling, and you'd hear, oh, this doctor 3 towns over is unhappy. And so you would call that doctor 3 towns over and have a conversation, and you would go from there. And 20 years later, now you might have a little bit of that, but more it's you're emailing them, you're texting them. The number of tools that we have to get a hold of our candidates is pretty exhaustive. There are a lot of tools that we can use to get a hold of our candidates. Many of them protect the candidate's privacy very, very well. You have to message them on a platform where you're not actually getting their phone number or you're not actually getting their email address, and you kind of talk through a platform, a third party, if you will. So I think that those pieces of technology have been fantastic, really, because it enables you to get to more candidates. It enables you to really just talk to a lot of folks that maybe you wouldn't have been able to in the past. I also think technology, of course, it's changed what the candidates are looking for. I read an article recently about how, it's some huge number, and I don't remember, it was in the 70s, close to 80% of candidates, they don't want you to call them. Eventually they want you to call them, but they want you to text or they want you to email. They don't like those cold calls. They may be busy. They may be in clinic or in surgery or napping or whatever the case may be. I think it's kind of changed what they're looking for. Also, definitely within the realm of what their work is, robots and AI tools that can help them in their practice. They want to know if your company, if your facility offers those things. And so as a company, you have to also be sure that you're keeping up with technology so that you're not old fashioned and that you can recruit these folks that are coming out in 25, 26, 27, 28. I talked to somebody last week who's coming out in 30.
Wow, that's really early.
Yeah.
And I think one of the things as scribes became more popular, it's not technology, but it's a human there. I'm really watching some of the AI from the EMR and the charting aspect. Last week, it was a physical scribe that was in doing an exam, but that was his whole job, was to follow the orthopod and chart and do all of that. So then the physician could engage and have those one-on-one conversations that you want with patients. And I thought that was really interesting. It's very much an investment for those organizations that do that. But I know on job descriptions and job postings, you want to differentiate from others. So soon, I think we'll see scribe or beyond using this EMR, we also have this, and it's somebody that is helping record those conversations and doing your charting so that it frees up those providers to really provide health care instead of typing all day.
I was made aware at a conference recently that there are tools that are literally the physician will set their phone down and it will transcribe everything. It's not related to the EMR, like it isn't the EMR tool, it's a separate tool, but it's basically a scribe in your phone, basically.
Yeah. And I think definitely this generation, a lot of people are more comfortable doing that. I know I use ChatGPT a lot. I think the more people embrace it instead of resist it, it will be here and it will be what differentiates you from your competitor in terms of speed. And unfortunately, physicians are still paid on productivity in most cases. So it gives them an edge in that way. It is also a retention metric in terms of work balance, how you get through your workday. So you're not taking charts home, you're not doing charts on weekends, your med staff's not mad at you because you are behind, or your billers aren't mad at you because you're behind. So anything that will give them something that makes their career more fulfilling, that they want to stay and be retained and work there for your organization. So given your experience with various facets of the industry, what advice would you give to someone just starting out in healthcare recruitment, physician recruitment, or healthcare in general? It's kind of a crazy industry.
Yeah, for sure. Become an expert in relationship building. Talk to people and listen to people. That listening is the most important part. It's key to successful healthcare recruitment. It's actually key to pretty much everything, listening. So many of us talk, and we don't listen. But every physician that I've ever talked to, they have a story. They have a reason that they got into healthcare. And if you find out what that reason is and you can appeal to it, build that relationship, keep in touch, even if they may not be right for the position that you're talking with them about to begin with, you may think about them down the line. That happened to me. You'd asked for success stories. There was a physician that I had a great rapport with when I was with LifePoint and recruiting for one of our Texas hospitals. We hit it off well. I enjoyed talking with him, but he was not right for the position at that time. And fast forward, I guess, probably 4 years or so, he reached out to me and was interested in a position we had in Oklahoma. And he said, I remember talking to you when I was looking at this position and thought you might know something about this position. And I was like, heck yeah, let's have a conversation. So, it's all about the relationship building. I've got another physician from one of our communities who, if you ask her why she signed and why she stayed for, 12 years or so, she would say Jennifer Lynch. And it was because I sat in a parking lot of a mall in front of a Dillard's having a conversation with her because that's when she could talk. And we talked for probably 2 hours. And it made an impression. And we didn't talk for 2 hours about the job. We talked about what drove her, what she was looking for, what her family situation was. We talk about everything. And so that relationship building, I can't say it enough. That's the important thing.
Yeah, I agree. And I think anybody that knows me, obviously we've known each other for a little bit of time, really that networking and those relationships you build throughout your career and your life, just very impactful. I wouldn't be where I was without those pieces. I think you would say the same as you continue to grow as a leader and within your organizations. So any final thoughts from you?
I think that if I were to share the thing that I like the best about what I do, it's that no 2 days are the same. You're not just repeating a task over and over and over again. I didn't know that what I do existed when I was in college, for example. I mean, obviously I have a degree in journalism, but I do like making people feel that they fit somewhere. And I enjoy hearing people's stories. And so every day is a little bit different. And if you can find joy in that, then recruitment's a good place to be.
I like that. That's really good. On behalf of myself and PracticeLink, we wanted to thank Jennifer Lynch for appearing on the Workforce Wisdom podcast. For our listeners, please feel free to reach out with any thoughts, insights, or questions about anything we covered today. Or if you wish to receive more information on how PracticeLink can help both physicians and recruiters, please visit our website or email plmedia@practicelink.com. My name is Christy Bray, and I thank you for listening to Workforce Wisdom.